So we talked a little bit about patients being the experts of their lives and of their conditions, and we really wanted to make sure that this meeting was different from our first meeting in 2022 in Atlanta. And the first one was very much about, again, not admiring the problem, but focus on action around policy, research and data, on workforce pathways, on delivery of care. And this meeting, we wanted to be more focused, still in those same four areas, but more on the communities and the people who are doing that work. And so I hope you received that as we intended and we designed these couple of days. And again, we didn't do this work alone. So I'd like to once again thank our co-convening partners, the Morehouse School of Medicine, the National Association of County and City Health Officials, the Century Foundation, as well as the National Caucus of Native American State Legislators. We had a lot of people who helped yesterday as well. We had people who were manning tables and bringing information to our students. We believe that everyone deserves to be seen, heard, and cared for. And this only happens when we're intentional about being inclusive, acting with integrity, all with the focus on reducing health disparities. That equity value is what's driving all the work that we're doing every day, not only at Pfizer, but I can tell by talking to so many of you that those are values that you also hold dear. And despite differing opinions across our country, we remain committed to maintaining the conversation about the importance of striving for health equity to produce better health outcomes for our historically marginalized and underserved communities. As you know, this is our second Health Equity in Action Summit. And in addition to the publication that came out of the first one, Melissa mentioned it earlier. It's called An Action Guide to Disrupt Inequitable Health Outcomes. If you haven't picked it up, please do. I'm very serious about that being a living document. It's something that was created with dozens of other authors, but I very much want to make sure that we're updating it so that it is, including the latest and the best in terms of ideas on what's happening locally, so that those ideas can be adopted or adapted and then adopted to different communities. After we launched that action guide, we wanted to put our money where our mouths were. And so we worked with our partnering organizations to define a grant program that was launched in partnership with another organization within Pfizer. So it was the Multicultural Health Equity Collective, which Melissa and I lead, and then it was the ITEM team, the Institution of Translation and Equitable Medicine. And we provided 11 organizations with grants. And so we hear you that this work needs to be continued, and we need to continue to have funding for that. And so I'm pleased to announce that recently we launched another RFP. Hopefully most people in this room already know about it, but we have, I think, a QR code that we're gonna flash up soon where we want you all to consider whether or not your programs would be eligible to apply for this grant. We're not looking for anything around research. Again, we're not here to admire the problem, produce another paper. This is really about programs that you know are working. We want to look at proposals that are around programmatic elements that are going to help reduce health disparities for underserved communities. And so we have the proposals up, the QR code is here, so please take a look. Ellen on my team, raise your hand. Ellen is going to be overseeing that. It closes on November 22nd. We don't think it's a huge lift because we want it to be simple. So hopefully that is plenty of time. But I am committed for as long as they keep me at Pfizer to continue to find ways to find this funding to provide it to you all to do the important work that you're doing. Okay, so what's next? So the next thing that we want to ask you to do is to evaluate what we've done here over the last couple days. Because we like QR codes, another one's gonna come up on the screen, and we ask that you complete a survey on the work that we've done these last couple days. In the survey, we also provide a couple of examples of what we think we can do next. in this conversation on equipping those who are on the ground doing health equity programs. We talk about, should we do a policy focused convening in DC? Should we do local town halls or community meetings? One of my ideas is that I would love for us to find a way to adopt a city. So not Pfizer by itself, but all different types of companies to say that if we look at the city and they have all these health disparities, how might we all work together to put programs in place, focus on social determinants of health, of course, to drive that forward? What should we be doing next to improve health outcomes? So that's also an opportunity in the survey for you all to make yourself heard. But beyond inspiration, we want this summit to be a call of action. The health outcomes of underserved and underrepresented communities are in your hands. Pressure, yes, feel the pressure, because it is in your hands. These communities need your creativity, your passion, and your skills. They also need you to come to the work fulfilled, so please make sure we're taking care of ourselves. They need innovative solutions to these long-standing problems. So I challenge each of you, as the last panel did, to focus on what you've learned in these last days and take it into action. Volunteer, advocate, implement, and look for opportunities to continue to connect with the people that you've met here today. And let us know how you're doing. When we go to earmark money in our budget, we say this work is important. But as we talked about earlier, we need narratives and your stories to say, Niesha, Melissa, we met X, Y, and Z person at the conference. We've done this thing together and we've helped this many more people. So that is your charge, to find ways to continue to work together and continue to tell those narratives so that we can continue to pull you all together as we can. I think I don't have any more housekeeping things. All right, we're all done today. Thank you so much.